All right, well, let's talk about something very important in our world here this morning. And of course, the new Republican-controlled House is scheduled this morning to vote to repeal Obamacare. And joining us on the phone, or actually not on the phone, joining us actually live from the Capitol, there he is, his smiling face, Congressman Brian Bilbray. Brian, good morning.
Good morning. My daughter tells me the weather's great back at home.
You know, I got to tell you, I don't know if you heard us talking earlier, and we'll just get this out of the way. 72 with 6 to 8 foot waves, Brian. 6 to 8 today.
Make it, just know how to cut my heart out.
I know, but you have important business to take care of there, sir. And tell us what's going to happen today and what it really means. And I think that's the important thing. What does it mean?
I think it really means there's going to be a vote. I think the vote is going to be strongly supporting that we repeal the bill that was passed last year. We go back and we do it right. We do it systematically. We address issues such as pre-existing conditions and young people staying on their parents' insurance, but we eliminate things like saying that Americans do not have the right to live in the United States unless they buy an insurance policy at the end. And we go back and talk about things, Dan, like allowing people in California to buy their health insurance in any state they want, break up this monopoly that we've created for the insurance companies, and also talk about a big one, especially one that I learned when I was a county supervisor working with the health departments, and that is tort reform. In California, we have a thing called MICRA that actually reduces the cost of insurance for physicians, 30 to 40%. The rest of the country ought to be looking like that, and we shouldn't have to be paying for lawsuits in other states because they don't have something like MICRA in their states. And our state couldn't survive, in my opinion. In fact, even a Democratic Assembly and Senate in California recognizes that MICRA and tort reform is essential for health care. It's too bad Washington wouldn't wake up to that.
Well, there's a lot of lawyers pulling the strings there, and it's all about lawyers making money, isn't it?
You hit on it.
Yeah.
You hit on it right on the deal. We can't afford to have lawyers in the delivery room. And the sad thing about this, look, our men and women in harm's way, our soldiers, do not get to sue their lawyers. Why does somebody on welfare and somebody getting free health care get to sue their lawyers? If it's really that important, we should be providing the most cost-effective health care, but you can't afford to continue to subsidize the trial lawyers. Yeah. And, I got brothers who are trial lawyers, and frankly, I think that them getting a little less money and people getting more health care is a lot more important than us, placating one group over the other.
All right, let's kind of get to the heart of this. Do you really think that there are pieces of Obamacare that you'll be able to separate out and change? I know there's a couple things you like you said, pre-existing conditions and keeping your kids on the policy as long as they're full-time students. But do you really believe, with the Senate controlled by the Democrats and the president controlled, obviously a Democrat, do you think anything can be changed in this bill? And what will it take?
Yes, I think the one thing is this mandate that employers have to start sending out, declarations to the federal government about benefits that people are getting. I think that when we talk about tort reform, I think the Senate is going to have to finally address that. I think the mandate that you have to buy something from somebody to be able to live in the United States as an American citizen is absolutely absurd. I mean, the next thing they're going to do is what they're going to do, say all Americans have to buy a General Motors car because we want that.
Or a Schwinn bicycle.
I think we can change all those things.
Yeah. All right, well, best of luck to you. And today, what time's the vote?
I don't know. It's going to be in the afternoon now, so hopefully we'll be able to address that issue. They're talking about it now. And I think this is a good example. Look, Dan, this is why we shouldn't have 3,000, 2,000-page legislation. This is why the new majority has gone to a 3-day waiting period before you ask anybody to vote on it. Not just so Congress can read it, but so the public can read it. And that's why we've got to go back,
new rule.
Break it up, and let's do it piecemeal. And if it's such a great piece of legislation, we should all be welcoming the chance to be able to go over it again.
All right. Well, listen, best of luck, Congressman Brian Bilbray, and we'll see you when you get back here, whenever that is.
I'm hoping to come back this weekend, so I'll try to catch you out there at Wind and Seed.
There you go. There you go. This is where you'll find me. Thanks, Brian.